So today we're talking about sciatica or lower back pain. Which one do you have? And so lower back pain itself is only back pain. And so in the lower back, you have 20 plus structures that can be causing you discomfort. Lower back pain can involve muscle, joint, tendon, ligament, some of those joints being the facet joints or SI joint. Another key thing about lower back pain is that it never really goes past the knee. And so when I'm talking with patients and like, oh, my pain's kind of in this region or in the back, that is back pain. That is most likely back pain and not sciatica. Sciatica will often go past the knee where lower back pain does not. So when we're talking about sciatica versus lower back pain, it is much easier to diagnose sciatica because of its key characteristics. The key characteristics of sciatica have to include, and I say have because it needs to be these to be considered true sciatica, is that you have to have pain down your leg into your foot or calf. And so notice how I said not in your lower back. Sciatica is often 9 times out of 10 not lower back pain. It is pain down the leg, and that is numbness and tingling or some sort of sensation changes. And so when I test my patients, I'll rub my finger or a light feather on their toes to see if they can feel it. If not, that is a sensation change. With sciatica as well, you'll have weakness into the foot, so you won't be able to either lift your toes up or go up into a calf raise because of the weakness caused from the sciatic nerve irritation. And so pain, weakness, and sensation changes down the leg are the key characteristics of sciatica. And so when we're talking about sciatica versus lower back pain, sciatica is a subset of lower back pain. It can be one of the many things that can be in your back causing pain down the leg. But sciatica, you have to have that numbness, tingling, sensation changes, and weakness. Those are the things that are sciatica. It's typically L4, L5, L5, S1, often from a disc herniation or stenosis, depending on your age or your history. But lower back pain is much more tricky in that lower back pain is coming from the lower back, but we just don't know exactly what. It's much more vague, and honestly, the treatment's actually a little bit more generalized. It's not quite as specific as sciatica. And so when we're treating the lower back, we want to make sure that we're actually attacking the structures in the lower back to make sure that you're improving. So lower back pain is much more common than sciatica. And I would say most time my patients think they have sciatica, but it's actually truly lower back pain.